Sex toys can definitely spice things up, but I want to tell you about 2 patients that I treated that will demonstrate that things don't always go according to plan. The most common issue that we see in the ER relating to sex toys is anal foreign bodies, and there are 2 main issues that you should know about if you want to explore this on your own time. 1 is losing the object, 2 is causing a bowel rupture. On one of my very first shifts as a resident doctor, I treated a patient who inserted a long PVC cylinder into their anus. They said that it went in really deep, and then they suddenly felt it get sucked in even deeper to the point where they couldn't reach it anymore. When the patient came to the ER, we couldn't remove it even under anesthesia. So the patient needed to be taken to the operating room for an open abdominal surgery to remove it. That suction effect is real. The rectal muscles and sphincters can contract and pull objects upwards. If a tube-shaped object goes deep enough, it can also create a vacuum that makes it really difficult to pull back out. The second case that I want to tell you about is a patient whose partner forcibly inserted a 12-inch dildo up their rectum. On exam, his abdomen was rigid and tender, and the CT scan confirmed that he had a perforated sigmoid colon, meaning that the dildo had punctured straight through the intestinal wall. So here's a quick anatomy lesson. The rectum and the sigmoid colon are S-shaped, so long rigid objects won't be able to follow those curves. And if you push it deep enough, it could puncture straight through the intestinal wall, leading to life-threatening infections. The takeaway is that if you're going to use anything for anal play, make sure that it has a flared base or a safety stopper or a safety string attached to it so that it doesn't get lost. And you know what? If something does get stuck or causes pain, don't try to remove it yourself, just come straight to the ER. This is a completely legitimate reason to come to the ER, and there's no judgment on our part. The main focus is on removing the object in the safest possible manner so that there's no other complications. I'm Dr. Jeff, a board-certified ER doctor, and I teach you about medical topics that you should have learned in school. Follow me to learn more.